Eric, let's go to the data real quick. The first data you will see, of course, is our standard slide. We're fairly flat, as you can see, 7,600 new cases. Unfortunately, our deaths are up above the 21-day average. Again, our hospitalizations are up over the 21-day average, and our ICU admissions are up. So none of those are good. None of those are good figures. Let's go to the next slide, Eric. Our standard 88 counties, as you will see, all counties are blue, which simply means they're all above the national CDC's guideline for high incidence. In fact, if we go down to our lowest county, which is Holmes County, they're about Holmes County is our lowest. They're about 3.5 times the high incident level. So everybody is very high. Eric, let's go to the next one. Okay, this is our advisory system, and you'll see one significant change. Let me just go through this a minute. We're not necessarily seeing a dramatic surge after Christmas yet, but there's a bit of an upswing in our cases. Reflecting this, Hamilton County is moving to purple this week. There are also 2 counties that are moving up to the watch list because of increases in healthcare utilization. That's Lorain and Claremont. So again, all in the same, Claremont's in the same region. Lorain, of course, is at the other end of the state. While most of our counties are not changing color, I did want to point something out on our key measures map. And if we can go to those maps next, Eric. And again, these are the maps that we would ask you to look at more than the color map that you just saw. These key measures are 2 critical pieces of information for every Ohioan to understand about the situation in their area. The new cases during the past 2 weeks in their county and the impact of COVID on their regional ICU beds. So that's the one on the beds. As you'll see, the new cases per capita at the statewide level has increased since last week, and that is not good. And this is where you see that here. We've gone up from 656 on an average statewide to 739. So we're seeing cases up, and that is certainly not a good sign. We were already at a very elevated level of 657 cases per capita last week. Now we're close to 740. On the other hand, the portion of ICU beds with COVID has gone down slightly. ICU use is a lagging indicator, so this is still coming down from our pre-holiday peak. However, it does look as though our cases are starting to increase again. So that is where we are. Let me